This is Kathy Knipfer, instructor for Nursing 2313, recording the community-based nursing lecture for Chapter 3, Cultural Care. The face of the United States is changing. There is increasing diversity of people in the U.S. Minorities comprise one-third of the U.S. population. It's expected that by 2042, minorities will be the majority of the U.S. population. With this changing face, it will be essential for nurses to understand the cultural dimension of health. Healthy People 2020 calls for achievement of health equity, elimination of health disparities, improvement of health for all groups, and it calls for increasing diversity among all health professionals. To be culturally aware, nurses must have a self-awareness of their own cultural background, influences, and biases. Self-awareness assists nurses to avoid the negative attitudes and actions of things like cultural blindness, ethnocentrism, stereotyping, and racism. Cultural blindness occurs when the nurse does not recognize his or her own beliefs and practices, nor the beliefs and practices of others. Ethnocentrism refers to the idea that one's own ways are the only way or the best way to behave, believe, or do things. Stereotyping is generalizing and oversimplifying information about others. Using stereotypes to make assumptions about others has a way of depersonalizing the interaction. Racism is where individuals believe that other individuals who are culturally, ethnically, or racially different from oneself are inferior. These behaviors perpetuate inequality and privilege and contribute to health disparities. Cultural knowledge encompasses the familiarity of the worldview, beliefs, practices, and problem-solving strategies of groups that are ethnically or culturally diverse. Community-based nursing practice requires that the nurse practices cultural humility so he or she can seek cultural knowledge and gain an understanding of the community. Cultural knowledge assists in appropriate assessment and intervention. Understanding the importance of cultural humility involves self-awareness, a commitment to lifelong self-evaluation, and openness to learning in cross-cultural interactions. Dr. Madeline Leininger uses the terms emic and edict to describe types of care. Emic is the local or the insider's view and values about a phenomenon or folk care practices. Edict is the professional or outsider's views and values about a phenomenon, and these are the professional care practices. Community-based nurses use both of these types of care knowledge and verify with the client and family those areas that are meaningful and acceptable. There are 6 phenomena that are associated with a cultural assessment. One is communication, which is a continuous process where one person affects another through written or oral language, gestures, facial expressions, body language, space, or other symbols. Space and physical contact. The concept of space is very important when we talk about cultural knowledge. How close people stand by each other in conversation, overt expressions of affection or caring with touch, and rules relating to personal space and privacy. These vary among different cultures. In the United States, the normal space for conversation between persons is an arm's length. In Muslim cultures, it is inappropriate for males and females to even shake hands before marriage. It would be highly improper and distressing for a female Somali client to be assessed by a male nurse. The social organization includes the family and other groups within a society that dictate culturally accepted role behaviors and rules for behavior. The concept of time has such a different meaning in various cultures. It is important to know of this dimension within the cultural group receiving care. This may create implications for making appointments, follow-up care, and proper medication administration. Environmental control is the ability or perceived ability of an individual or persons from a particular cultural group to plan activities that control nature, such as illness causation and treatment. The meaning of health and illness to a particular cultural group influences the health attitudes, beliefs, and practices. Biologic variations include the biologic differences among racial and ethnic groups. It can include physical characteristics such as skin color, physiologic variations such as lactose intolerance, or susceptibility to specific disease processes such as sickle cell disease in the African American culture. When communicating with individuals from other cultures, knowledge of communication styles and meanings is essential. We would look at verbal and nonverbal behavior, space, the roles of the family members, making eye contact, salutations, and intergender communication patterns that vary significantly among cultures. When assessing space and physical contact, we would look at how close people stand to each other in conversation. We would look for those overt expressions of affection or caring that involve touch. And we would be focused on the rules relating to personal space and privacy because they do vary greatly among cultures. Space or physical contact must be considered when we're providing or planning for care. We must take the meaning of time into consideration when we're planning care for individuals from different cultures. As we said previously, this may affect scheduling of appointments, medication administration, and follow up care. And also, past, present, and future orientation should be considered. When assessing the client's social organizations, the nurse must understand the family or kinship patterns of the group being served. This would include the definition of the family, gender or age roles, traditional roles that impact caregiving, the value placed on children and the elderly, family involvement and religion in healthcare decision making, and the sharing of information within the community. The nurse should be aware of biologic variation specific to clients being served. This is imperative for effective care. Some variations are obvious, like skin color, hair texture, facial features, and stature. Some are less obvious and are based on medical information and research. Examples would be the presence of certain conditions, tolerance for certain foods, medication absorption and variations, use of herbal remedies. Two important concepts the nurse should know about culture is one, acculturation, where the individual learns ways to exist in a new culture. The other concept is assimilation, where individuals or groups identify more strongly with the dominant culture in values, activities, and daily living. An example of assimilation would be children of immigrants from another country who have identified with the surrounding culture. Let's look at a couple of definitions related to cultural assessment. Cultural skill is the ability to collect relevant cultural data regarding the client's health history. Cultural assessment involves the systematic identification and documentation of culture care, beliefs, meanings, values, symbols, and practices of individuals or groups with a holistic perspective. There are multiple models for cultural assessment or assessment tools. One example is the Andrews and Boyle Cultural Assessment. Data are organized in a manner most consistent with the nurse's practice environment and the group with which the nurse works. Assessment should always include the client's greatest concern and how the client perceives the nurse may be helpful. A cultural encounter is an opportunity for the nurse to engage in direct contact with the members of cultural communities. There are three modalities to guide care, according to Lininger and McFarland in 2006. This is described in Table 3-1, page 68. The three modalities are cultural care preservation and or maintenance, cultural care accommodation or negotiation, and cultural care repatterning or restructuring. Cultural preservation and or maintenance. This refers to those assistive, supporting, facilitative, or enabling professional actions that help people of a particular culture to retain and or preserve relevant care values so that they can maintain their well-being, recover from illness, or face handicaps and or death. An example would be in the Amish community, where the extended family, neighborhood, and church expect to assist and care for members within the community. So the nurse works in this community to encourage and support ways to enlist this help. Cultural care accommodation or negotiation. This refers to those assistive, supportive, facilitative, or enabling professional actions and decisions that help people of a designated culture or subculture adapt to or negotiate with others for a beneficial or satisfying health outcome with professional healthcare providers. An example would be a Muslim who adheres to the practice of praying 5 times a day. The nurse would negotiate as to what time an appointment could take place in between the praying sessions. Cultural care repatterning or restructuring. This refers to assistive, supporting, facilitative, or enabling professional actions and decisions that help a client reorder, change, or greatly modify lifeways. This creates new, different, and beneficial healthcare patterns while respecting the client's cultural values and beliefs. When assessing, the nurse may find practices that may be detrimental to health and well-being, so he or she will work with the client to change behaviors that are harmful. In summary, health and illness are strongly influenced by culture. The effective nurse will strive for cultural sensitivity and competence through cultural awareness, cultural knowledge, cultural skills, and the cultural encounter. Question number 1. How can nurses know what the cultural norm is when the nurse's culture is different from the client's culture? A. The nurse must learn about the cultural norms of every cultural group in his or her community to always be able to predict client preference. B. The nurse learns about cultural traditions and beliefs by reading, observing, and asking questions. C. It is impossible to predict cultural preferences related to space and privacy. D. The nurse relies on agency protocol to treat all clients equally. The answer is B. The nurse learns about these cultural traditions and beliefs by reading, observing, and asking questions. However, it is important not to stereotype people and to always realize that there are often individual differences within cultural groups. When in doubt, it is important to ask clients or their families to state their preferences. Question number 2. The advantage of the cultural encounter is A. The nurse has the opportunity to engage in direct contact with the members of the cultural communities. B. Through frequent contact with numerous members of a cultural group, the nurse learns that variations exist within the community and thus avoids stereotypical expectations. C. Trust builds over time between the caregiving nurse and the members of the community. D. All of the above. The answer is D. All of the above. The cultural encounter is the opportunity for the nurse to engage in direct contact with members of a cultural community. Through frequent contact with numerous members of a cultural group, the nurse keeps in mind that variations do exist within the community and that stereotypical expectations are to be avoided. Trust builds over time between the caregiving nurse and members of the community, and it's essential to the well-being of both. Question number 3. In some cultural communities, the extended family, neighborhood, and church expect to assist and care for ill or disabled members within the community. The nurse working in this community encourages and supports ways to enlist the help of the extended community and facilitates ways to let the care needs be known. This is an example of A. Cultural preservation, B. Cultural care accommodation, C. Cultural care repatterning, or D. Cultural assessment. The answer is A. Cultural preservation. The nurse identifies those cultural care practices that are helpful to the client. The nurse then assists, supports, facilitates, or enables the client and family to preserve those actions or behaviors. Question number 4. Your client has lived in the United States for about 10 years. She is not taking her prescribed medications. You are perplexed because you thought that she understood the importance of taking the medications. So you decide to do a cultural assessment. What is the first question that you ask? A. What is your cultural background? B. How is this kind of illness treated in your country? C. How do you think that your cultural beliefs impact your perception of your illness? Or D. Why aren't you taking your medication? The answer is B. How is this kind of illness treated in your country? Knowing the client's cultural background may or may not provide helpful information, nor will she necessarily be able to articulate how her cultural beliefs impact her illness. Asking why is not sensitive and may come across as threatening. However, she will be able to talk about how her illness would be treated in her homeland. This is a very non-threatening question and is a good way to start the assessment.